Cough Monitor Suite is Hive's research tool built specifically for objectively measuring cough in clinical research. So we provide it to pharma sponsors and academics who want to understand cough in different diseases and how cough patterns change over time. Unlike existing tools that really focus on 24-hour snapshots of cough, Hive's Cough Monitor system is built to monitor cough continuously for long periods of time. So 24 hours a day, 7 days a week. And that's really exciting because it means for the very first time, we can see how cough patterns and trends change over long periods and over the course of a study or over the course of a patient's treatment. Cough Monitor Suite is comprised of 3 parts. So the first is a watch, which is preloaded with Hive's cough monitoring software, and it counts coughs and timestamps them, and it also tells the time. The second part is the companion app, which runs on iOS and Android smartphones. And that app is designed to collect PROs, so patient-reported outcomes, and to transfer those cough timestamps, the data from the watch up to the cloud. And then the third element is the Hive dashboard, which is where study staff, so sites or sponsors, can manage participants and also see real-time adherence data that they can act on to ensure they're getting really good adherence. And they can also access cough data in that dashboard if it's appropriate to do so. Hive's core technology is software that automatically counts coughs. The easiest way to think about it is it's much like a step counter, which counts steps on your phone whilst you go about your normal daily life. Hive software does the same, but with coughs. It's made up of 2 algorithms. The first one is processing audio using the microphone, looking for peak sounds, which could be a cough or could also be a baby cry or a dog bark or a door slam. And then we take a small snippet of that peak sound and we run it through a second algorithm. The second algorithm is a classifier, which is built on a huge database of very varied coughs. And this second algorithm will determine whether that peak sound is a cough or not a cough. If it's a cough, it timestamps it, and what you end up with is a series of timestamps that tell you exactly when each cough happened, without any kind of humans or manual counting involved in the process at all. So privacy has been a really important design criteria for us. We really wanted to build a technology that patients and study participants were willing to wear for very long periods of time. And unsurprisingly, most people aren't willing to wear something which records their audio or transmits audio from their lives to somewhere else to be reviewed. So we put in a significant amount of engineering effort to ensure that our algorithms run entirely on the watch. That means that both the peak detection algorithm and the classification algorithm happen on the watch, and all that leaves the watch are cough timestamps. So no audio is ever recorded, stored, or transmitted. And we found this to be a really important driver of patients being willing to wear this technology for a long period of time. So as well as building this accurate cough monitoring technology, we've built out a whole suite of services that help researchers, both pharma and academic, to use Cough Monitor Suite really well in clinical trials. We have built up that experience over more than 50 studies in a huge range of indications and all around the world. And we provide everything from logistical support to help desk to training materials to ensure that Cough Monitor Suite is really easy and accessible for people to use. We have built up that evidence over a really wide range of studies, from proof of concept all the way through to phase 2B clinical trials. And then next year we will be primary in a phase 3 clinical trial. We're also supporting really large real-world evidence studies across many countries at once. So adherence is a really high priority for us at Hive. We want people to be able to wear these devices every day for long periods of time. Some of the ways that we've tackled that include design choices. So we selected a watch because it's a very familiar form factor. We chose one that is slim, lightweight, and looks much like an Apple Watch, so people are happy to wear it. We ensured the battery lasts for over 3 days, but we encourage participants to charge nightly so that we can check in on them if battery charge is not happening regularly. We have an entire alert system which notifies study staff if patients are not adhering, either if they're not wearing or not charging or not syncing. Syncing also happens automatically without any patient interaction whatsoever, and all processing happens on the watch. So privacy is preserved at all times, which is a really important factor in patients being willing to wear the device for long periods. So yes, of course, it's been very important for us to validate the software as being accurate at counting coughs. We just completed a 30-person validation study where participants wore the Hive device on one wrist and an audio recorder on the other wrist. And we take that continuous 24 hours of audio and we have it labeled by trained labelers. And then the important part for us is the correlation between the coughs that the Hive device detects and the coughs that are determined by the labeled audio. We look at Lin's concordance correlation coefficient, and very pleased to say that that's 0.974, so very high, very close to 1. We also look at median sensitivity, which is just over 90%, and the rate of false positives, which is just about 1.5 per hour. These study results were obtained by participants who were going about their normal daily lives. So they were driving a car, they were listening to radio, they were playing drums, they were using tools, and we're really proud that we can get such automated, accurate results that really reflect people's normal daily activities. So until now, clinical research has had to rely on two options. One is a patient-reported outcome. How much does the patient think they're coughing, which we've shown to be fairly unreliable in terms of accurately saying how much they're coughing. Or two, a device that is an audio recorder that is attached to the patient and then manually labeled by humans listening for every cough. And those devices are limited because they tend to only be used for 24 hours. They're expensive because of the humans involved, and they're also not so comfortable for patients to wear because they're attached to them and recording their audio all day. What Hive brings is this easy to wear form factor that can passively and automatically count coughs over really long periods of time. And the result is that we finally get to see how trends and patterns change. It's particularly important in cough because cough is very variable day to day. So if you're focusing purely on 24-hour snapshots, you might just look at a really good day or a really bad day, and you don't actually get to see how those trends and patterns change over time. So researchers get a wealth of information from this long-term continuous cough frequency data. Because we timestamp every cough, you receive cough in its kind of most granular form. And then from that, you can derive loads of other interesting statistics. There's a lot of interest right now in bouts, so groups of cough, where patients cough quickly in succession, because that seems to have a particularly big impact on patients' quality of life and maybe linking with other symptoms such as incontinence. You can look at silences between coughs because we know that patients really value a long period of time when they don't have to think about whether they're going to cough or not. And you can also start to look at change point detection. So you can understand the exact moment where a patient's cough increased or decreased and use that to determine whether medication is working or whether there are particular triggers that the patient might want to consider how they're affecting them.